Hi everyone, and welcome to Psoriatic Disease with Joint Involvement and Becoming a Parent. I'd like to thank everybody for having me here today. I'm very excited to present my story to all of you. So before beginning, here is a list of my disclosures. So I am the co-chair of the Canadian Association of Psoriasis Patients. CAPP receives project funding from pharmaceutical companies, and UCB Canada provided unrestricted educational grants to the following alliances for which CAPP is a part of. So some of the learning objectives for this presentation will be to discuss the experiences of living with psoriatic disease with joint involvement as a woman from a personal perspective, list some of the key questions and challenges of women who are considering pregnancy from a personal perspective, and to describe the needs of women and to support them with living well with psoriatic disease with joint involvement throughout pre and post-pregnancy. So to start off, I'd like to give you all an idea of what my journey looked like. So my psoriasis journey started in my late teens, my early 20s. I started having a lot of issues, primarily with my feet, a lot of itching, a lot of burning, a lot of bumps. I went to my GP. She prescribed me cream for what she thought was a type of athlete's foot. I said, okay, went home, started using the cream. It didn't work for me. Tried to get another appointment with my GP, which, as most people know, is not the easiest thing, more nowadays, but even back then. So I kept trying different things, had seen her a couple of times over the next 6 years, different diagnoses, different creams, telling me it would go away on its own, etc. Fast forward 6 years, I finally was able to convince her to give me a referral to a dermatologist. And around that time, when I was getting my referral to my dermatologist, I had also started my nursing career. So this is where my perspective becomes a little bit different, because you'll see my journey from being a patient to being a nurse to becoming a mom, dealing with all of these issues. So once I got my referral to see my dermatologist, I had to wait another 8 months in order to get an appointment with this dermatologist. So in the meantime, still trying to manage it all at home until I was finally able to see the dermatologist. Once I came into the dermatologist's office, I took off my socks. He looked at my feet and he looked at me and he said, honey, he's like, I know what you have. He's like, you have plantar pustular psoriasis. He's like, this is exactly what it is. I'm going to give you a prescription of 2 topicals that you're going to use together, and it will take care of your problem. And it did for a while. He was absolutely right. It took care of my symptoms. Almost immediately, I started to see some relief, some improvement, and I was good for a little while until I started to have joint pain. So I started my career as a nurse. I was working at Emerge, started noticing that I was getting a lot of hip pain, a lot of pain in my ankles, in my hands, in my toes. So I went back to my GP, who then, because of my psoriasis diagnosis, decided she was going to send me to a rheumatologist right away, thinking that the two were related. Get my referral to see a rheumatologist, send it in. There's another wait list, minimum 6 months. So I'm trying to manage this on my own, Tylenol, Advil, naproxen. Meanwhile, my psoriasis is doing well, and I started a new job as a case manager for patients with inflammatory diseases who are on biologic treatments. Now, this gave me a whole new perspective because I was dealing with patients who were going through the same things that I were. So this gave me a very different view because I was able to see myself in my patients, see it as they were going through it, but then get to see the medical side and why certain things take so long. But also feel their frustration at the same time. So at this point, I finally get to see the rheumatologist. He's looking at me, not too sure, sends me for some tests, says could be RA, could be psoriatic arthritis. He's not 100% sure. Go and do blood work. I went to do an MRI, x-rays, came back inconclusive. He could see that there was some inflammation, couldn't tell from where, nothing definitive. He tells me, we'll keep an eye on it and see if it progresses. He goes, but from right now, I don't have a clear diagnosis for you. And I went on my way with that. So in this instance, I was starting to work with patients who were experiencing the same thing that I was. Having one inflammatory issue, psoriasis, and then having symptoms of another, but without clear diagnosis, long wait lists to see specialists, not really any communication, the GP referring to the specialist and then the specialist prescribing something and then being sent back to a GP without too much information in between. So that's kind of my storyline, and I did work as a consultant nurse, a case manager for biologics for patients with inflammatory diseases for 10 years. So I got to see a lot of people going through my journey and trying to help them as best I could go through their journey into trying to understand and navigate all of these things that could happen in the process. And the frustrations of wait lists and not having definitive answers and trying to manage multiple symptoms and trying to see what is going on. So this is my snapshot, and this all led up until I got pregnant with my first child. So one thing I noticed in dealing with my patients before I actually got pregnant was my patients who were female and who were becoming pregnant or wanting to become pregnant or who had just had a child were noticing a lot of the same common factors, which were gaps in information, misinformation, and a lack of communication. So I'll focus on the lack of communication first. And this was more so noticed because there's so many people involved in patients who have inflammatory diseases and things of that nature, where you have your GP and then you have a dermatologist, a rheumatologist, and now we have an OB who's coming into the picture to follow, for all of the pregnancy part of it. So a lot of this information kind of gets jumbled, kind of gets lost. There's a lot of misinformation, a lot of gaps in information. The OB not knowing too much about specifics about inflammatory diseases, referring back to the specialist, not able to get appointments with specialists, going back to the GP. And there was a lot of back and forth during this process that I noticed for my patients and for myself, kind of not knowing where to go. One of the topics that came up a lot with my patients was not knowing if they were supposed to continue their treatment, were they supposed to stop their treatments, what were the possible outcomes, whether they decided to stop or continue, and trying to find this information was kind of difficult for them and for myself. At sometimes I was finding myself, referring patients to their pharmacist to get more information, or faxing doctors' offices trying to get information, or even in my case, going to the pharmacist and asking what I should do, if certain things were okay to continue during my pregnancy, was I good to continue, should I stop certain things, and this became a clear issue in dealing with my patients going through the process, but also my own process. There's not a lot of information available for stuff like this, and a lot of studies have not been done on pregnancy and pregnancy outcomes for certain treatments. So there's a little bit of hesitation there, even if doctors are telling you to continue. do you really want to? And that was something that I helped a lot of patients go through. So that was a major thing that I noticed. Not only during the pregnancy, but also after the pregnancy. Where does it come in when breastfeeding is involved? Should I breastfeed? Is it safe for me to breastfeed? Do I start back my treatments? Do I wait? What are the consequences of waiting if I decide to breastfeed for a longer period of time? What am I looking at in terms of my symptoms and how they're going to be, whether it be during pregnancy or after pregnancy? A lot of information was not given. The OB doesn't really know. The GP has some information, but not enough. And during that time, one of the biggest problems with my patients was being able to get into contact with their specialists and being able to get the information and the appointment they needed. And some of them didn't even know that they needed this information until it was brought to their attention. So there's a lot of lack of information in that area in the grand scheme of things. And that's a big issue that I see, that there's that big lack of information and there's no clear continuity of care when it comes to women who are going through pregnancy and trying to decide what's best for their bodies, what's best for their babies, etc. So in going back to pregnancy, some of the common questions that I found I had in common with my patients was, how would this diagnosis affect me wanting to be a mom? How would it affect my pregnancy? And what would post-pregnancy look like? And in the grand scheme of things, it was another subset of information that was missing. A lot of the emphasis obviously is put on the mother's health during the pregnancy and carrying a healthy baby to term. But in terms of the diagnosis specifically, what does this look like for me? What does becoming a mom look like for me? How will pregnancy affect me? And even post-pregnancy, how is this going to look for me? And these were very good questions that women were asking, and unfortunately there's not a lot of information available. We don't know how and to what extent certain people will be affected. So it's a very difficult question for people to ask, and a lot of people don't really have the answers. They can give you a ballpark estimation of, what things are going to look like. But the information is just not there. So what I'm going to do now is give you a snapshot of what my pregnancy looked like. And one other thing that I would like to add is, while I was dealing with all of these new flares of symptoms and inflammation and pain for myself, I was also dealing with a new baby. I wasn't sleeping well, and my beautiful son has severe eczema, and found out later he also had some very severe food allergies. So that was something else to add on to the stress of dealing with all of these other things that I was experiencing, and seeing my little boy also having the itching and the flaking of his skin from his severe eczema. It's heartbreaking when you know what it feels like. So on top of that, it's really an emotional experience as well. So in looking at all of this and the experience that I had and the experience that my patients had or are going through, there are several calls to action that need to happen, I think, for women, especially of childbearing age, that are looking at wanting to start families, or who have started families and didn't know what they were going to be dealing with in having these types of inflammatory diseases. And one thing that is definitely sure is that pregnant patients may need a little extra support during pregnancy and often need to manage flares or new symptoms after pregnancy. And that's a big thing to take into consideration. If you have something that you're already dealing with, and then you're going through the beautiful experience of being pregnant and starting a family, and then you give birth to your child, and all of these new and wonderful feelings you're having with your family are overshadowed by flares and symptoms and pain and an increase in severity that you were not expecting. Can really change the experience of starting a family. So things that I really think are important and need to be looked at and have a focus on is, patients need to be helped to understand how their conditions might impact them getting pregnant, and whether they may need to change what they are currently doing to manage their health. So, things that they need to look into. Do they need to change their medications? Do they need to stop their medications? Can they continue? What are they going to do during their pregnancy if they can't continue with their current treatment regimen? How does that look for them? How can they manage symptoms? Taking a proactive approach to educating your patients about what they can expect during and after pregnancy. Forewarned is forearmed, 100%. Had I known that after going through such an incredible pregnancy where I was almost symptom-free for 9 months, and even then more than 9 months, because they only came back when my son was 6 months old, but having known what I was going to be getting into, I would have better prepared myself for that situation, because I was not at all prepared for having to deal with what was coming. I was having trouble getting out of the chair while holding my son in my arms. My husband had to help me get up. So these are all things that I would have thought through and arranged myself differently had I known that these things were possible. And I think having the knowledge too helps you better mentally prepare for having to care for a young child while caring for yourself in a different way than, your standard day-to-day self-care. And another thing is help your patients to understand whether their child may or may not be increased risks to their health because of their treatment plan and what is known about the disease. Many parents worry about causing diseases in their kids. So I think that it's really important that you help your patients understand what are the possible outcomes of using specific treatments, or if there's an impact in patients in their childbearing years, but also if could be a potential impact on their children, whether passing on the disease that they have to their children, or that there be a possibility that their children end up with something similar. These are all things that a lot of parents don't think to ask, but the information is so helpful in order to wrap their head around it if it's something that they're gonna have to look at in the future. And I think that information is not always brought up in conversation with their patients, unfortunately, and I think it's something that's really, really important. In my personal experience, my son's eczema could be completely unrelated. I just find it coincidental that we both have very severe inflammatory reactions to things. So I think it's something that needs to be discussed more openly with your patients, but also patients, women, do not be afraid to ask questions to your physicians. That is what they're there for. Knowledge is power, and knowing and being able to advocate for yourself and your body and your health is so important. And if you're not getting the answers that you need to find a way to get them. So definitely on both fronts, patients need to understand what they're getting into, and doctors need to be there to provide the information. And above all, remember that sex and gender matter in treating women with psoriatic disease or inflammatory arthritis. Thank you all for your time, and thank you for listening to my story. I am so grateful to be here today, and I hope that my story can help someone else going through something similar. So thank you very much. Bye-bye.